Good evening, my name is Stephanie Akins and I am a student at Excelsior University. What's going well is I've kind of worked ahead a little bit on my classwork to try to get things finished quicker. Thinking back to a clinical experience where I had to demonstrate leadership while working with the interpersonal team was while I was in clinicals, not this past weekend, but the weekend before. I had to work with one of the nurses, and while we went to check on a patient, the patient had vagal down, and before I realized it, I had already, started telling people, grab her feet, let's move her to the bed, let's get her on the monitor, let's check her vitals. The patient had vagal down essentially and become unresponsive. The charge nurse actually was in the room when all of it went down, and I started, telling us what to do, and she's like, we need to hit the rapid response, and I was like, okay, I felt pretty confident about the situation because I kind of knew what was going on. I deal with a lot of emergency stuff, so it wasn't really anything new to me. Whenever I felt for a pulse, she had a pulse, and I knew that she was going to be okay. There's not really anything I say could be better or worse. I think we handled the situation appropriately and effectively. The patient came around within, I say, 30 seconds to a minute. She was more responsive. She knew where she was. She could answer questions. I've seen people vagal down in many different situations before, so this was nothing new to me. One of my fellow classmates, she kind of understood what was going on as well, and it just happened to be both of us have experience in the emergency department, so we knew what was going on, and we just started doing what we knew needed to be done. The only thing I can say that we could have improved on was whenever the nurse's aide put the patient on the toilet instead of the nurse's aide walking out and leaving her on the toilet. Somebody probably should have stayed with her, knowing that they were trying to get her to use the restroom, and while she was having a bowel movement, she vagaled down and become unresponsive. If we had not had found her when we did, the outcome may have been completely different. With her vagaling down, she was pressing too hard or bearing down too hard to try to have a BM, and her blood pressure essentially bottomed out, and she became unresponsive, and all because she triggered a vagal response whenever she was bearing down. The next time she uses the restroom, we did not leave her side. We made sure to tell the nursing assistants that, hey, you cannot leave her. She has to be watched. She's already vagal down one time. After we got her in the bed, she was fine. After she came around, we called rapid response. Her heart rate and her blood pressure all came back up. Within 30 minutes, the patient was sitting up, eating, drinking, talking on the phone, just like any normal person would be. I made sure to keep checking on the patient afterwards, and I informed the nurse that she did not need to be left alone, so any other time she went to the restroom, I would make sure that I was in there with her, or someone else was at least, so then that way we didn't have to worry about her vagaling down again. Anyways, I don't really have anything else left to say. I'm wearing a scrub stop, and I appreciate you listening. Have a great day.